Fellow NAAOP members and friends, it's Peter Thomas in Washington, D.C. It's been 3 weeks since my last web update. I am the General Counsel of NAAOP and the Counsel to the O&P Alliance. The Supercommittee deliberated in earnest for about 3 months, but turned out not to be so super. In fact, the Supercommittee failed to achieve their goal of reaching $1.2 to $1.5 trillion in identified deficit reduction over the next 10-year period. This was widely expected, and in fact, my last webcast I discussed the likelihood of the Supercommittee not reaching agreement in the end. What that means is that the sequestration provisions will go into effect starting January 1 of 2013. That means that Congress still has almost 13 months to try to come up with some mechanism to stave off automatic across-the-board reductions to both domestic spending programs and defense programs. And it's possible that they'll do that because, in particular, there are so many against the deep defense spending cuts that will have to occur if sequestration goes into effect as planned. The end of the year, however, is not quite complete. Congress is negotiating as we speak a deal to figure out how to extend payments to physicians at or slightly above their current levels, rather than having a 27.4% cut in the Medicare physician fee schedule that is set to take effect on January 1 of this year, just a few weeks away. That fee schedule is a problem, has been a problem since 1997 when the Congress passed the Balanced Budget Act. And Congress is really trying in earnest to try to figure out a way to not only provide reasonable payment for physicians, but also to extend the outpatient therapy caps under the Medicare program as well. I should say the exceptions process to the therapy caps so that caps don't go into effect. This costs money, and that requires offsets. And they're looking at offsets from other Medicare providers to try to pay for some of these extensions in the physician fee schedule, which over a 2-year period could be as high as $38 billion. That means that they're scouring the Medicare program and looking for ways to reduce expenditures on other providers, including hospitals, home health, inpatient rehabilitation, and a variety of other mechanisms and ways to reduce spending. The House Republicans seem to be farther along than the Senate Democrats, and it looks as though they're putting together a package this week and early into the second week of December. That package looks like it will take spending cuts from the Affordable Care Act, which is the health reform law, and repeal some of those provisions, as well as some Medicare spending cuts as well. That probably won't fly in the Senate, and therefore we're expecting, a last-ditch effort to try to extend the physician fee schedule so that physicians don't receive a huge pay cut the first of the new year. But I think we're going to be here until Christmas Eve, if you don't. That's my guess. Next issue is the NCMRR anniversary. The National Center for Medical Rehabilitation Research is a center at the National Institutes of Health, NIH, that is devoted to rehabilitation research and including orthotic and prosthetic research and development. This is a center that was created in 1990. The legislation passed in 1990. It was officially begun in 1991, and so this year is the 20th anniversary of the NCMRR. And in fact, in just a few days, the NCMRR will celebrate that anniversary with a celebratory dinner and a symposium on the research that NIH has conducted over the years on rehabilitation science. In particular, a large portion of that will be orthotic and prosthetic research. We mention it in particular because that's one of NAAOP's original founding goals, was to improve research in the area of orthotics and prosthetics. And of course, many of the O&P organizations in the O&P Alliance are very focused on research going forward as we continue to be confronted with evidence-based practice and the need to demonstrate the value of what orthotists and prosthetists do on a daily basis with patients. Also, I wanted to quickly mention the Veterans Administration's issues. Many have heard of veterans. The Veterans Administration has proposed a number of different changes that would dramatically alter how VA care is provided to amputees and others with disabilities who require orthotic and prosthetic care. We're monitoring the situation very closely. We're talking with the Congress and the relevant committees and the members and staff of those relevant committees, and we're making every effort to make sure that veterans continue to be served well and that private practitioners in the orthotic and prosthetic field continue to be one of the main sources of the provision of care. 97% of orthotics and prosthetics to veterans is provided by private practitioners through contracts with the VA. That may change in the future, but we're aiming to make sure that the veteran does not receive either delays in care or less choice or poor quality care as a result of major changes that are being contemplated at the VA. So with that, I'll say thank you very much for listening, and prior to the holidays, I'll do one more webcast to inform everyone as to Congress's status at that point. Thank you.